Hi, everybody. It's Dr. Laura, and we are going into season 2 of the Dr. Laura podcast. Now, we did a little intro, so you've got an idea that we've changed our name from Dr. Laura Connects to Dr. Laura with Brainiac University, and I just think this is so much more apropos for what we're doing. We're going to start a new season, and this is all about the child. So it's going to be all about childhood development, and we're going to jump right into it because we have a lot to talk about. There was a change in February of this year by the CDC for developmental milestones, and I have to tell you that I'm really blown away because we think if we just change something, then it's okay. We can just kind of follow it. And I can remember even in chiropractic school, I used to think that children just kind of develop whatever's right for them when they want to do it. And then I had my own kids, and I really learned that that's not true. These things are signposts to tell you, hey, be alert. And I can remember my little guy, now not so little, 34 years old, but he walked at 10 months. And I used to think, well, this is boy genius. And it wasn't until he got into grade school and I understood how he was actually having trouble differentiating sounds. And he had a fabulous second grade teacher who was the one that actually pointed it out to me. And he does have a significant history, and that history matched why there might be something going on. So today, 26 years later in practice, I can tell you your specific journey is really the blueprint of what is going on, not only for you, but if you choose to have children, what's going on for you is going to impact them. And those developmental milestones are the signpost to tell you, hey, pay attention. So we have all kinds of changes in when children should walk now, when they should speak. And I have to tell you something, the light bulb went off for me, which would be a gamma brainwave, okay? When the light bulb goes off on a situation or an idea and you come up with the solution, that's your gamma brainwaves. So when I was doing a course for neurofeedback, one of the services we have in our office, the owner of the company who oversees the neurologist who create our reports was going over normative data. So when we get back a report, it shows you on the bottom of each bandwidth the standard deviations away from a normative data bank. Okay, on other pieces of equipment, same kind of thing happens. So he was even talking about how, because there have been so many changes in brain waves, that they're updating the normative data, or it's maybe questioning, bringing into question normative data. Now, we've got to be so careful with this. So let me kind of complete that thought process. So, for example, we have more kids today using tablets, devices, etc. We know that they are getting exposed through these devices. This electronic work on the computer is literally increasing the number of alpha waves and no, I'm sorry, not specifically an alpha wave, white matter of the brain. So you have gray matter where you process, and you have white matter, how you get all that information out there, okay? So this is like if I need to bring something from the left side to the right, or the front to the back, or even in some kind of oblique direction. This is just an incredible network up here. And certainly in shows down the line, we'll really get into networks because it's a very important part of the brain to understand. So we are finding through imaging, digital tensor imaging, DTI, digital tensor imaging. Yes, that's it, DTI. We are finding out through that imaging that it's actually increasing white matter, okay? Now, what does that mean for your little person? That means too many trains on the track. So I get this image. Chicago's got an incredible subway system. And if you look at the hub, there's just tracks everywhere. And I think that's a great analogy of what's happening. So kids can't filter. Kids can't have a chance to really process information and absorb it and utilize it if they're using these types of devices all the time, because they're literally changing their brain. Now, yes, this can happen to adults as well, but it matters for children. It matters, are there developmental windows? And there are. So when you come into this world, you are fully formed, but you are not fully functioning. You must go through stereotypical movement. Let me underline that word, movement, in order to take your brain from brainstem dominant to midbrain to higher brain, which is then going to be the executive function. If you miss out on these movement patterns, you are not wiring your brain correctly. So let's just take crawling. So crawling should be for about 6 months, and you should start around anywhere between like 5.5 to 6.5 months. You should be on all 4. So it matters the posture that you're crawling, and it matters how long, and it matters when do you start. Because most of the time what I get back on intake forms, oh yeah, my kid did everything and they did it early. Well, early doesn't necessarily mean better. Remember how I started? My little guy walked at 10 months. So what that means is he didn't crawl long enough, okay? He shouldn't be pulling himself up, practicing weight-bearing exercises until about 10 months. But he's still then supposed to pull up, bounce around a little bit, and then get back down on the hands and knees and crawl. So that crawling pattern is absolutely essential for communication in the brain. So you have tracks that literally are going to go from the brain down the opposite side of the spinal cord to the peripheral nerves. And then you're going to have communication that goes back up the peripheral nerve spinal cord to the opposite side of the brain. You're not going to get this communication patterning until you crawl. And I'm really highlighting these words even on the website, because patterning is how the brain works. It's looking for the patterns. This is how we know that neurofeedback works. The subconscious mind is looking for the patterns that you are introducing or providing for the special senses like your eyes and your ears. So if you don't crawl long enough, you don't get that practice. If you crawl atypically, like on that one little diaper commercial where the little girl is scooting around on her bottom. So I believe what we try to do is we make something look like it's okay just for the benefit of a culture. But it is not okay to scoot around on your bottom. There is a reason that the child is not getting down on the hands and knees. Think about it mechanically for a minute. And I always talk about the 3 tiers: mechanical, chemical, brain. Okay? Let's just look at it mechanically. Why can she not get down on her hands and knees? So if I were to put myself in that posture, I would have to be able to get down on my hands and knees, and I would have to bring my head up so that I could look. One of the classic things that can happen unexpectedly and not intentionally, but something can happen to the cranial vault when you're being born. Well, first of all, it could be a C-section, and your head never get the big squeeze. That's a very important part. I can speak to it directly. My little guy ended up being an emergency C-section really because of my ignorance. No judgment to anybody else, but looking back, I didn't know enough about pregnancy and delivery, and my little guy was only 5 pounds 15 ounces. There is really no physical reason why, but there was lots of things going on in my own neurology that made it difficult for us to be in the right rhythm. So having a C-section became the only option, and it did. It impacted the cranial vault. That can happen. Thank goodness for people like me, chiropractors, we look at that cranial vault. Cranial work is marvelous. In fact, with him, even when he was 8 years old and I found out some stuff was going on with his eyes, I dove in there. We worked really hard for 4 years. He was in glasses at 8 years old, and he could stop wearing them by the time he was 12. So there's lots of things that we can do. So we don't want to think that just because a pregnancy ended in a C-section, we're doomed, because we're not. That's why it's important to talk about these pieces, because we want people to get the best care that they can possibly get for themselves and for their babies, so that you have optimal development. Because that little girl scooting around on her bottom in that diaper commercial, she is adapting, but it's coming at a cost. Okay? That's the big idea. It's coming at a cost. And that cost will end up showing itself typically when these kids are in school. And unfortunately, the longer we wait, the harder it takes to change something. And the reason for that is because of the age. So why would it take more? Well, it's all based on neuroplasticity. That's probably the easiest way to introduce this piece. So what does neuroplasticity mean? It means if I'm given enough repetition to learn how to do something, I'll be able to do it. If I get the wrong input, if I don't get enough, if I can't engage with it, because it's not always about what you do, it's also the ability of that little being to pull that information in. So if I get enough of it, I'm going to hit a threshold. And when I hit a threshold, I'm then going to be able to, fire that network and get things connected, because the things that fired together wired together. So if you were to stop and think about a child moving around for a minute, just consider how many things are going on all at the same time. Okay? So if I'm crawling, I've got the arch being developed in the hand. I'm moving the opposite arm and leg. That movement has to go from the upper body to the lower body. I have to bring the head up. I have to be able to move, which is going to incorporate my vestibular system. I've got to be able to look. My primitive reflexes have to be integrated so that the same arm and leg don't try to go out. I mean, we could sit here and break this down, and there would be so many things going on together. So what fires together wires together. And this is why now we can see these marvelous networks that actually exist in our brain. Okay? So if I'm not getting enough stimulation, if I'm not able to engage with it and the pattern isn't correct, we're going to create faulty wiring. So it's all about the number of repetitions, the intensity, and the frequency. Okay, so I'm sure you've heard of the saying, 21 days to a new habit. Okay, so shake your head yes if you're out there and you've heard it before. But you know what? That only works if you're a toddler. It's how many repetitions is it going to take to change a behavior? So this is why talking about the milestones is so critical, because the longer we wait to address the problem, the harder it's going to be. So you've got some nice open windows, but around 7.5 to 8.5, when these kids are going to school, the cortex is going to cement based on the patterning of what's been going on. So during pregnancy and during those first years of life, you go through a combination of neurogenesis, making nerves, and pruning. So one of the things that have come up in the research regarding autism is that there seems to be a problem with pruning. Well, that's kind of like what we were talking about, what the DTI imaging is showing from too much device interaction, is that we're getting too much white matter. So if we cannot prune neurons effectively, then we don't have good organization. We've got too much up here. This is why babies' heads are bigger in the beginning, and then as they go through more pruning, then the head and the body take on proportional sizing. But this pruning is necessary, because if not, you get confusion. So with pruning, we are practicing, and whatever we practice the most, those are the neurons that we are going to keep. Okay? This is a very important part, because just because you practice something doesn't mean it's the right pattern for the brain. So if I'm looking at two kids, one that crawled on their hands and knees and one that crawled on their bottom or scooted on their bottom, that's an issue. So those are two totally different patterns. Now, we are marvelous at adaptation, but as I was saying, adaptation comes at a cost. And I wish I could tell you that it's just this laundry list, because that's not necessarily true. Yesterday in the office, we got a great opportunity with one of our guys that's getting ready to graduate this week. And we were practicing taking a smaller hula hoop size and spinning it on one arm. So if you're watching the video, you see me spinning my arm. If you're just listening, you put the hula hoop on the arm and you spin it. And then while it's moving, we're going to put the other arm in there. And then we're going to take the other arm out. So the smoothness of being able to go from one side, transition through the middle to the other side, is a reflection of communication on both sides of the brain. The timing, being smooth with that motion, not throwing the hula hoop to the other side, being able to control the speed of your arm, the rhythm of your body. That's timing between both hemispheres. That's a product of crawling. That's one example. There are so many. So for example, the need to talk is on the right. The work of talk is on the left. That communication, to be able to have a conversation, is timing. So I'm going to give you a little scenario that you can try with your child, if some of this is ringing a bell going, wow, that's just like hitting the target. That's showing me that that might be part of the problem. So it's called the organization of lateralization. One of the ways that we can look at, did this child progress the way that they are supposed to, and that their brain got organized through this process of neurogenesis, pruning, lateralization, is we are going to declare dominance all on the same side. So you should have a preference of the right eye, right ear, right hand, right foot. Now it's equally right to be on the left, but it should all be on the same. Now let me give you a couple of points to remember if you want to do this little test with your person. Do not favor one side. Place the object on the table and let them reach for it. So for example, if you have a kaleidoscope, that's what I use. But you could use a toilet paper roll, a paper towel roll, act like it's a pirate telescope. Put it on the table, ask them to put it up to their favorite eye. Place your phone down, let them put that up to their favorite ear. Have them do a writing sample and then see what hand. How do they hold that little pencil? And then roll a ball and gently kick it. You do it actively. You don't overly guide. You don't tell them what you're going to do. You try to do it very spontaneously. Now, if you're curious what this means because you see something that it's not all on the same side and you want my feedback, send me the video. You can send things right to our office phone and we can take a look at it. So the office phone is 678-501-5172. And I'll be happy to look at it. And from there, if you want to have a quick chat, we can do that. And then you can see if Connect My Brain is a good match for you and if you're a good match for us so that we can bring your little person forward. So just think for a few minutes how much information I've given you, okay? So we started off with, there's been a change, a horrific change that is going to impact our children. And the CDC has come out and has changed the developmental milestones. I compared this to what even other software instruments are looking at because of all the different cultural things that are going on and how it is affecting normative data banks. So how do you think we got here? We got here with the CDC changing the same way that these software places have, because we have so many kids that are not developing as expected. About 3 years ago, it was considered to be 1 in 5 kids. Brown University came out last year and said that children born during this time, in the last couple of years, are expected to have a 21% cognitive disability. Guys, we've got to pay attention to this, because what's going to happen is if you think that something's going on with your child and there are new guidelines and you go either to the school or you go to the pediatrician or anybody else that is going to follow this, they're going to tell you, oh, no, everything's fine because the CDC said that it will be okay if your child does it later. No, it is not okay. We are literally setting ourselves up for a much bigger population of children that are not going to get wired up correctly. Now, I am sure that you have already heard that because of mask wearing, that we have speech issues. Children are so dependent on being able to see the whole face in order to figure out how to move the mouth, to articulate, in order to shape and form letters and sounds and words. I've already had conversations with parents just in the last few months going, look, your child's speech has changed. We've got to overly formulate our sounds, our words, our letters, so that if they had it before this time of mask wearing, that there will be those neurons that we can help reconnect. But we got to put some effort into it. And then their oxygen levels. I did this all the time during the last couple of years when the masks were so prevalent. And I asked the parents, can I please take the mask off while the child is doing their aerobics, because they're not getting enough oxygen. You know, it only takes 20 seconds for your oxygen to drop down, to fire up a fight or flight response in your brain. Think about where these kids' state of health has been. And now we're going to make it okay. We're going to say it's perfectly fine if you don't walk until this age, and it's perfectly okay if you don't speak until this, when we already were at a deficit. Meanwhile, if you do go over and look at the CDC, make sure you go over there as well and check out their own stats as it relates to what has been found in our children: depression, anxiety, and behavioral disorders that are literally, the numbers are astronomical. We have the greatest disadvantage going on right under our noses for our children. And it is time. It is time for us to wake up and realize. It was before I was always saying, we're losing a generation of people. When the autism numbers escalated in the 80s and have just kept going this entire time. Now we have an entire new set of problems, and it is escalating. And the population that has been so impacted is our children. So I am speaking out. I want people to understand what we're dealing with. In the next episode, we are going to talk about what is developmental delay. I really use that framework a lot because I don't like labels. A lot of times kids are actually on target when they're born, and then they have a tendency to regress. That is a completely different set of circumstances than being born with an organic issue. So, as I was indicating, we've got to make sure that our children get the proper environment. And that's not just at home, but that's at school. That's everywhere they're going. Because it does take a lot to get that brain stimulated, get them to be engaged, get them to find that balance within. And it is far more than just a 21-day program or utilize 5 or 10 points and your kid's going to go in the perfect direction. As I was letting you know earlier, the 21 days is great for a toddler. If a toddler sticks their finger in a light socket, you might tap it and say no, maybe 1 or 2 times, and the child typically will not go back and put their finger in the light socket. But as you get older, the number of repetitions are far greater. So as we move along the chronology, once you get to 14, it is thousands of repetition. So my term is called stacking neurology. We want to bring as much into that environment as we can, but it's got to be the right. It's not always about stimulating. Think about the little ADHD kid with hyperactivity. You don't necessarily think about stimulating. In fact, it's a balance. It's a balance between, do we need to stimulate or upregulate, or do we need to inhibit or downregulate? And that's the benefit of getting connected with somebody like me, who can do a developmental assessment, identify those red flags, and make a plan that's personally right for your little person. Okay, so class is over for today. So we look forward to meeting you next time, and we will be discussing what is developmental delay. Have a great day.